Good morning, and it's so good that you created time to join us this particular Thursday. We are so glad that you created time for Daybreak this morning. The program continues, and we want to do something a little different before we get into our usual cooking segment. This particular morning, let's talk about matters health for a little bit. There's an important event that is being organized that will showcase what we can achieve as a country when it comes to local manufacturing of health products and technologies. We want to talk about the status of our country in as far as meeting our health care needs is concerned, and what can be done to bridge the gap that has been there when it comes to access to some of these products and technologies. What are they? That is why we are here to talk about this, and I'm having this sit down with Dr. Tom Menge. Dr. Tom Menge heads the Directorate of Health Products and Technologies at the State Department of Medical Services under the Ministry of Health. Thank you so much, Daktari, for creating time.
Yes.
All right, so we'll get into it straight away. There's an important exhibition that is slated to be happening from the 13th, that's tomorrow, and the 14th of this particular month. And it's going to showcase a lot that the country can be able to achieve. I just want you to let's begin this conversation by painting a picture of what's the major objective and the goal of this particular exhibition.
Thank you very much. The specific exhibition that we're going to have on Friday and Saturday, we've themed it the Local Manufacturing Expo. Basically, what we'll be doing during this time is to give an opportunity for Kenyans to come and understand that within the space in this country, we have quite a lot of manufacturers who are able to manufacture and distribute health products and technologies. When you look at it in the overall goal of UHC, one of the agendas of the government then is to really encourage us to be able to buy Kenya and build Kenya. Mm-hmm. And if you look at the space of health products and technologies, that is medicines, medical products, various devices, and other technologies, we have a large group of Kenyans who have been involved for many, many years in the manufacture of it. But you still find that we are really dependent, or we seem to believe a lot in products that come out of this country through imports. The opportunity that we are giving the local manufacturers during this time is, first of all, to showcase what is it that they have, and then what are we doing as a government to encourage them so that that industry that employs very many Kenyans can also be, the public may know about it, and we can believe in it.
All right. So when you're having, this conversation, we're trying to change the narrative of those who think that as a country we can only depend on what is coming from other countries to be able to meet our healthcare needs. For somebody who could be asking, of course we are going to be having this exhibition, do we have anything to showcase as Kenya? What would you tell them?
I believe that this invitation is for all Kenyans.
Uh-huh.
The best way to go about it is to invite the local manufacturers. Let me just give some examples. We have 34 companies that manufacture pharmaceuticals. Indeed, if you go to any of the surrounding countries, you'll realize that most people believe that the Kenyan products is the bedrock of their pharmaceutical supply system. Mm-hmm. But when you come to our country, we realize that most, close to 70% of the products that we use are imported. Mm-hmm. And therefore, what is it that we have done or not done, or what is it that we can be able to do to really encourage the local industry to know that they are supported, that there are policies that support what they do, that there are opportunities that are being offered for them to be able to, before exporting the items that we manufacture here, that they can first of all be consumed locally. Mm-hmm. That is the purpose of the two-day meeting. It's also the opener for the UHC week, which will be celebrated next week. And if we can be able to say that our health products and technologies, which constitute close to 40% of the healthcare budgets for most households, then we can be able to make that a strong foundation for us to be able to have a successful UHC.
Mm-hmm. What would you say in terms of who you're targeting for this exhibition, the two-day event that is being planned for this weekend? Who is the target, group?
So the target is the public. Mm-hmm. Let me also say what will the event have an opportunity to do. First of all, it's an open event where every single person can be able to walk in and see what is happening within this country. Mm-hmm. We have been deliberate. Most of the time when we have opportunities like this, we have the importers of pharmaceutical products or other health products and technologies being the people who come because it is easy for them to be able to showcase what they already have. But this time is deliberate, so the target will be the general public, healthcare professionals. We are also looking at other core players in the space of industry. And let me just expose it wider, because it's not only pharmaceuticals, because it is easy to talk about pharmaceuticals in the relation of production. Mm-hmm. But Kenya has got the potential, and COVID really taught us that there are very many other products that are produced. So there are people who do diagnostic products. There are people who do other technologies. For example, within the oxygen space, we are producing a lot of oxygen within the country. This is a health product that we've been able to really up the game on. And there are also other people who do various medical devices that are currently available. Even a hospital bed is a technology. And therefore, most of the time you're realizing that we're importing this from other countries when we've got the ability to produce them within the country.
All right. And you've talked about COVID, and one thing what COVID taught us was the fact that we needed to be self-reliant as a country. That time, each and every country was busy focusing on their own health needs, and that is the time that we discovered as a country that we could actually do a lot of things when it comes to addressing our healthcare needs. And before we get to how this seeks to provide innovative solutions, let's talk about how to promote confidence in the locally manufactured healthcare products and technologies, just for people to know that it can actually work, so that we don't over-rely on the imported products. How do we achieve that?
So one of the things that we'll be discussing a lot during this two-day meeting, and it's an agenda that we'll be able to pick up and continue advancing in the days to come, is the fact that Kenya has got institutions that are able, first of all, to regulate and also to assess the quality. I'll give two institutions, for example. Our Pharmacy and Poisons Board has gotten quite a lot of acclamation throughout the world because of its ability to regulate stringently some of the medicines that we use within the country. We are working in the next few months to ensure that it achieves a maturity level that will enable us to confidently export to any part of the world. So there is one aspect of regulation that is also coming out very strongly, that what is our regulator doing to give us the assurance that the quality of products that we have are good enough. But we also have a National Quality Control Lab. Indeed, our National Quality Control Lab is WHO pre-qualified, which means that the World Health Organization has given it confidence or assured itself that the kind of tests that they do locally meet their stringent requirements. And therefore we've got both the regulatory and the laboratory capacity to assure Kenyans that the products that we have in the market are very good. We also have a very robust pharmacovigilance, sorry for the word, but actually for the products that are already in the market. Our board very regularly takes things from the market to assure itself that what is in the market is of good quality as what they've received for regulation.
All right. Dr. Lee, how do you foresee this initiative generating innovative solutions that will contribute to the revitalization of health products and technologies manufacturing?
Now, one of the complaints that we've had from the manufacturers, the local manufacturers, is that we have not provided them opportunity to sell their products within the country. We are working with the Ministry of Industry, Trade and Investment to set up a situation, and indeed there was a pronouncement that was made from the cabinet meeting on Monday that the Kenya Medical Supplies Agency has been directed that they prioritize procuring the products that they use and distribute to health facilities within the country from local manufacturers. Those are some of the deliberate decisions that are going to be made from now going forward. So if we can be able to assure a market for, first of all, ensuring that our Kenyans obtain products that are of assured quality, that will be one. The other thing that we will be doing in the coming days is to create a wider market in the African free trade area. You realize that Kenya has got the potential of being a manufacturing hub for the region. Already we are doing very well. Indeed, if you go to any neighboring country, as I said earlier, you'll realize that most of the pharmaceuticals and other healthcare products that they use are manufactured within the country. How can we be able to take advantage of our capacities to be able to sell that product to the region?
And I like that you say that sort of like they believe in the value of our products more than we have actually realized within our borders. So we actually need to change our mindset and begin to appreciate what we can be able to do as a country, because it has been proven that other countries are actually getting most of their products from us. And I want us to talk about, the strategies that you feel would be most effective in promoting and supporting the local manufacturing of essential healthcare products, in this time that people are really keen on affordability and quality of some of these products. What is it that you feel should be done to ensure that we not only achieve value for our money, but also, we access some of these, products and technologies?
So one of the concepts that has come overall that is being used is the word market shaping. Market shaping in the space of health products and technologies mainly looks at two areas. First of all, ensuring the quality of the products that we have within the country. And secondly, having a legislative and regulatory environment that really encourages the various products that we have. So we are looking at two things. Can we be able to increase capacity? Can we be able to have an opportunity for investors to feel confident that within this market they've got various assurances that can help them manufacture within our area? The Ministry of Industry and Trade and Investment, for example, has given quite a lot of incentives within the EPZs and the special economic zones. And we've had actually some of our manufacturers come in and set up shop there. The second thing then is to work on the regulatory environment to make it facilitative. And I think that's the word you're going to hear more and more in the coming days, that the government and the regulators are going to be facilitators as opposed to auditing the processes. So if we can be able to establish a good environment, then we'll encourage investors to consider that Kenya is the place to come for investment. It's
the hub of these products. And what do you think are some of the public and private factors that would play a pivotal role in determining the feasibility and establishing local manufacturing capabilities and capacities within our borders?
So if you look at the public sector is the main consumer of health products and technologies. But the private sector is the main source of the health products and technologies. We are in a space right now where each of those players need to take their place. So we need the manufacturer to have the confidence, because it's mainly drawn from the private sector, to know that if I manufacture this item, then there is a market for it. But we need the public, first of all, especially in the space of UHC, as the main consumer of these products, then to be confident enough that if we can be able to source these products locally, there are advantages. And we are not only helping the Kenyan economy, but those are the sources of employment for our staff. And therefore, the whole of this is both public and private initiative.
How are we cascading this to ensure that we have the right people to manufacture some of these things locally? Are we targeting also learning institutions with this narrative?
We have had various discussions, and in a discussion that we had earlier on this week, we realized that a lot of the industry do not draw on the expertise of our learning institutions for very basic things, including management of the facilities, repairs, standardization, and so on. But in the same way, we've had various local manufacturers who have taken advantage of our current capacities. So the conversation goes beyond, are we just manufacturing? Or our plants, our factories, are we working with the universities to be able to help us get the actual human resource that we need that can be able to provide the technical expertise going forward. We are also encouraging our industries as they set up to have a very specific agenda on technology transfer. As they set up within the country, especially the multinationals that are setting up within the country, we are encouraging that they'll take up local people, and we'll be able to see a lot of technology transfer so that the capabilities are within the country. Especially in the area of technology, we are starting to have very robust associations. We've got the Medical Engineers Association that has really come up, especially during this time when we've been increasing the oxygen capacity within the country. And they have shown us that it is possible for the equipment, the cylinders that we do, that as a country we have the capacity to be able to maintain our own technologies.
Let's go back to the exhibition. It's happening 2 days from tomorrow, that's 13th and 14th. I want us to talk about if you're targeting people to come and sort of display what they can showcase as part of the products and the technologies, what is expected of them to be part and parcel and to participate in this exhibition.
So for the past few weeks, we have reached out to most of the manufacturers in the healthcare space through the associations and through individual contacts. We have had meetings with them about the opportunities that we are offering. We have listened to them about their challenges. So apart from the opportunity to showcase what they have, we have 2 dialogue meetings. The first one is going to be a ministerial dialogue, where we're having the various players, the Ministry of Industry, the Ministry of Health, the Ministry of ICT, and the National Treasury, coming to have a dialogue with the manufacturers, just to listen to what their concerns are. Secondly, we are going to have a technical dialogue. The technical dialogue looks at the regulator. It gives opportunity for the buyers like Kenya Medical Supplies Agency or the Mission of Essential Drug Supplies to be able to dialogue with the regulator, to dialogue with the ministry officials, and just find out what are the policies that we need to address. And I think going forward, we are going to have an opportunity to really co-create the issues. If we are coming up with a policy, we have been specifically directed that every policy that you create at the Ministry of Health needs to incorporate the manufacturer and the private sector. And therefore, that is going to be our agenda in the coming days.
All right. I see one of the biggest issues that is going to be put on the table is to address the market barriers. And why do you think this is a concern when we are talking about local manufacturing of health products and technologies?
So when we look at the data that we currently have, Kenya still utilizes or imports 70% of its health products and technologies. Yet if we look at our capacity, we can be able to change that narrative. We have done studies in other countries, and I'll give an example of the country of Bangladesh that also used to import 70% at the same level that we are of their health products and technologies from out of the country. Within a 5-year period, they're able to transform that they actually source right now 95% of their products from the local industry. There is nothing within that capability that stops us from doing that. But what we really need to assure the local manufacturer is that they have a market for their product. So what policies, what changes do we need to do within the space of HPT or health products and technologies to ensure that that market is assured? There are various pronouncements that we hope to be able to make, very deliberate pronouncements, to give that assurance to our local manufacturers. And I believe in the coming days, it will be our responsibility as the Directorate to ensure that those pronouncements are effected. The other thing that we are going to do, we are going to have an opportunity to launch some of our best documents. We need an essential medicines list. We've always had an essential medicines list. We are also hoping to launch our essential diagnostic list and our essential medical supplies list during this period. Those are the things that are going to guide all parts of industry, including financials, on what as the government given as the basic medicines, the basic medical supplies, and even the diagnostics that are going to be used in the health space. These are going to be the foundational documents for effecting UHC and hopefully addressing the issue of healthcare financing.
All right. And what are we going to be looking at in terms of making sure that we have a competitive edge, not just locally, but also globally? Because I don't know whether this applies in the medical field. When you look at other products, when you're talking about Buy Kenya, Build Kenya, you'd find that a product that is made in Kenya is more expensive than one that has been imported. What is it that we are doing to ensure that that is not the case when it comes to the health products and technologies?
Yes, so I really did talk about the area of market shaping. For the space of health products and technologies, you not only need to have a product that is considered to be more competitive in terms of money, but you also need to assure yourself that the quality of this product is as good as I can get it in any other market.
All right.
And therefore, in the space of health products and technologies, you cannot talk about price alone.
All right.
You need to give the user an assurance of quality. And therefore, that is why this conversation will be both regulatory and in the space of manufacturing. We are also in a very good space because in the coming months, as Africa, there's been a definite decision that we create an economy that self-sustains itself. As I say that Kenya has an advantage because of what we have invested in the past to be a manufacturing hub for health products and technologies. And therefore it will be our responsibility. After this expo, we are hoping to now move ahead and have an international expo where we can showcase our products to the region and take advantage of the economies of scale in the African region to be able to market our HPTs.
All right. Is it the first time we are having this in our country, and where will it be taking place specifically?
So for the Expo, it is the first time we are having a government-led initiative to be able to have health products and technologies being exhibited. I think that is a uniqueness, that this is a government-led process as opposed to either private sector or a non-government-led process. That is what is exciting for us. The event is going to be held at the Kenyatta International Conference Center. We have set up a big dome tent in the COMESA grounds at KICC. That is where the event will be. The doors will be opened from 8 a.m. Tomorrow morning. The setup will be completed by today, and there's a lot of excitement in the air, especially from our local manufacturers, that for the first time they are seeing a government incentive or initiative that is helping them feel that whatever they've been doing, they have the government support. So it is for the first time that the Ministry of Health, in collaboration with the Ministry of Investment, Trade and Industry, is coming together to actually say that we recognize the local manufacturing space, and it is clear that the government is supporting this process.
Are we planning to sustain this annually, or it's too early to tell?
I say that this for us forms the first of many.
Okay.
And the agenda is really going to be set by our players in the local manufacturing industry. But I can assure you, next year, we are now inviting people from Africa for us to be able to showcase what Kenya is doing, and therefore give the assurance to the local manufacturers that there are systems that are in place for us to go beyond our own borders and to go to other areas.
All right, good to know that we are getting bigger going forward. In the few minutes that we have left, I just want you to give us your clarion call. There is an exhibition here that we ought to be taking advantage of as a country, just to address some of the challenges that has been bedeviling our healthcare systems. I want you to what's your parting shot? Why should we really take this important opportunity serious?
So number one, it's my appeal to Kenyans. First of all, we have capacity. Secondly, we have the capability. We have the technical know-how. We have the expertise that is able to really concentrate on local manufacturing. And my appeal is, I think the evidence is in the seeing. So my invitation to all Kenyans is that in the next 2 days, please make your way to the Kenyatta International Conference Center grounds, and we shall, first of all, showcase, and secondly, we shall have a dialogue that will establish the agenda. We feel that we need to be facilitators in this process. We have created the policies, we have done the legislation, but the best thing is to work together with the local manufacturers, the private sector, and the general public to see the assurance that is there, and also just the showcase. We see the variety of areas that each of us can be able to penetrate in the space of health products and technologies.
All right.
So you're all welcome. Thank you.
All right, you're all welcome. Dr. Tom Menge, he's the head of the Directorate of Health Products and Technologies at the State Department of Medical Services, which is under the Ministry of Health, this morning, talking to us about an upcoming exhibition that begins tomorrow, the 13th of October 2023. It will continue also on Saturday, the 14th of October 2023, yes. And of course, there's going to be a lot that you should expect. The launch of products and technologies, documents, of course, high-level discussions that will also be happening within the 2 days that this exhibition will be taking place. KICC is the place to be tomorrow and Saturday. Of course, we just want to take a very short break. We'll be crossing over to the other side. Each and every Thursday, we take you in the kitchen. And this particular morning, I will be cooking alongside Chef Mike. Do stand by for that and much more.